Hello and welcome back to another EMR Quick Tip video. I'm Jared Karen and I have Amanda Diamond with me, and you have another question about vaccine ordering.
I do, Jared. I'm wondering how to put in an order for a vaccine in the future. So I have a patient coming in a few weeks to get a vaccine, and I just want to put the order in today. Can I do that?
Oh yeah, so that makes a lot of sense, right? If the patient's coming in the future, we don't want to wait until the day of and then have to interrupt the provider just to get an order for a nurse visit, right? If we know they're coming in. Mm-hmm. So there is a way to enter an order ahead of time.
Okay, great.
But what you'll have to do is actually do it in a separate update. So this just makes it look cleaner in the chart, and you can go and find that order easier the day of instead of having to fish through an office visit to find it. So you're going to start a new update, and then it's actually a special encounter type. We call it vaccine/medication order.
Okay.
And then, of course, you would select the ordering provider, and you don't need a visit ID for this. So once you start that update, it opens a new note, and there's not a whole lot in this note. It basically just says that this is a vaccine or medication order, and there's two forms, vaccine order and medication order, which do exactly what they sound like they do, which is put in orders for either vaccines or medications. So we're going to look at that vaccine order form, and you're going to notice that it looks almost exactly like the main page that you would see in an office visit.
Except, Jared, I see that it's there's some yellow up top. It's highlighted. It says immunizations to be given on or after. That's typically not in the other form, so I'm not sure what that is.
Yeah, so that's a good catch. That is something that's different about this form. And what that is it basically is a start date. So it tells us when the order goes in effect. So you'd want to put the earliest date that you'd want to give that vaccine.
Okay,
And
so
then,
like according to the CDC schedule, I would kind of do like the minimal interval there.
right, so you want to make sure that you don't put it too close together with another vaccine or with another dose of the same vaccine. So that would be one thing, and then of course the provider would also have maybe a schedule in mind that they're ordering. So that's one component of it. Now, these orders basically are good for 6 months after they're signed in the chart. So the start date isn't when it expires, it's when it starts. And then it automatically will be 6 months from that date.
Okay.
So it gives us a window to get it. So you wouldn't have to do a separate order if, say, the patient rescheduled their nurse visit.
Okay.
So another thing that you'll notice is different about this form is that there is no green button to sign it.
I thought something looked a little different down there.
Right. It's true that there is no button. And that's because we don't need to print like a consent form unless you wanted to keep track of that consent form until the day of the patient's visit. Otherwise, you're probably going to print a new one anyway. So there's no need for that button. All the provider needs to do is check off the vaccine or vaccines that they're going to order. And then once they close the form, they can simply final sign the note and it'll be in the chart. And let me show you an example of what that would look like. You would actually see in the chart this order refer, and then you'll see the order for the vaccine, and then this would of course be the provider's signature, not a nurse, but that would be your order that you could use.
So now the patient comes in for the day of the visit, the nurse visit, and I would go searching through the chart for this. And then when I see this, all I do is just take that information and put it into the immunization main page form in the visit?
Right, it would basically be just like using a standing order, right? But you would use the previous order on file, and you would pick those vaccines, you'd print the form. Because now the order's already in the chart, you're just printing the consent form.
Okay, so I should be using this form if we're talking about any future vaccines to be given. So
right.
So if the provider writes anything in an office visit note or anything like that, that's not an order.
Yeah, it doesn't really give you enough information usually. They might say, okay, come back for your Hep B vaccine, but you'll see this is very straightforward, telling you the dose and how many times to give it. It's more of a formal medication order.
Okay, awesome. Great, thank you so much. This was very helpful.
You're welcome. I'm glad it was helpful. Now, you brought up a good point about it when the patient is here. Let's say you had that same scenario, right? The patient shows up, but you don't have an order like this in the chart. What do you do then?
Well, the provider would just have to put the order in for that day, on that day.
Yeah, exactly. So you hopefully would catch that before the patient actually shows up. You can get it maybe squared away in the morning before the patient comes in. But basically, you wouldn't have to do this separate note or separate update, you could do that inside your nurse visit note, just like you would with an office visit. So the provider would go into the main page, click the vaccine, and print off the order.
Okay. Awesome.
All right. Clear as mud?
It is now. Thank you.
Good. Gold medal.